Hi, welcome to Microbiology Mentor. Today we will be discussing about blood culture. So what is a blood culture? A blood culture is a laboratory test in which blood is taken from a patient and is inoculated into a bottle containing a liquid culture media to determine whether the infection causing microorganisms are present in patient bloodstream or not. So, detection of bacteremia and fungemia remains one of the most important functional of the clinical microbiology laboratory, and the presence of living microorganism circulating in the bloodstream of a patient has substantial diagnostic as well as prognostic significance. So let's see what is diagnostic importance first. So a positive blood culture establishes and confirms the diagnosis of the bloodstream infections. At the same time, it tells about the etiological agent for a patient's illness. At the same time, it also provides etiological agent for antimicrobial testing, which allow optimization of antimicrobial therapy. Now let's see what are the prognostic importance. So a blood culture that grows a clinically important pathogens indicates the failure of host defense to contain the infection. So it is important in prognostic as well as diagnostics. So let's see what is one blood culture, how it is defined. So one blood culture usually consists of blood which can be obtained from a single venipuncture. Most of the time it is 20 ml approximately for the case of adult, which is inoculated in two separate bottles, keeping an optimal blood broth ratio of 1:5 to 1:10. Use here, it is important to discuss that use of more than one formulation, like in case of two blood culture bottle, both aerobic and anaerobic, generally maximizes the recovery of all possible pathogens when we are targeting a blood culture test. So let's see what are the recommended volume and the number of blood cultures. So for a neonate to 1 year of age group, 0.5 to 1.5 ml per bottle is preferred. Children's between the age of 1 to 6 year, 1 ml per year of the age divided into two different blood culture bottles. Similarly, child weighing 15 to 40 kg, 10 to 20 ml divided between two blood culture bottles. Similarly, adult and children weighing more than 40 kg, 30 to 40 ml divided into two blood culture bottles. Now let's see what is the significance of timing in blood culture. So study says that there is no significant difference in the positivity rate of a blood culture obtained in relationship with a spike. So no relationship with a spike, you can obtain a blood culture irrespective of the fever spike. Blood culture should be obtained simultaneously or over a short frame time. Drawing blood culture at intervals are usually indicated only when you have to document continuous bacteremia, like in cases of patients with infective endocarditis, or when an endovascular catheter, like catheter related infections, is to be present and documented. When acute sepsis or another conditions like osteomyelitis, meningitis, pneumonia or pyelonephritis, it requires immediate institution of antimicrobial therapy. So as much as possible blood volume should be drawn, that is, draw two blood cultures of maximum volume consequently from different anatomical site before starting a therapy. When it is appropriate to draw blood culture from patients on antimicrobial therapy, it should be kept in mind that the blood culture should be obtained when antimicrobial effects are at the lowest concentration. Now let's see about the collection of blood culture from a venipuncture. So select a different venipuncture site for each blood culture whenever multiple sets of blood culture are advised. If due to poor access requires that the blood drawn through a port is an indwelling catheter, a second culture should definitely must be obtained from a peripheral site. It is recommended not to draw blood from a vein into which a IV solution is running. Except for neonates, draw 2 blood cultures in succession. Now regarding the blood culture transportation, so it is advised and strongly recommended not to refrigerate the blood culture bottle once it is inoculated with a blood, although it can be held at room temperature until it is processed, and that too not more than 4 hours of duration. So it should be immediately transferred to the laboratory. However, in any case of delay, a delay should not be maximum for 4 hours, and the blood culture should be held at room temperature. Apart from that, if the blood culture bottle is an automated one, then it should be referred to the manufacturer instruction for appropriate method to store blood culture prior to incubation and in an automated culture monitoring system. And the laboratory should ensure that during the transit the bottles are intact and not broken. Now let's see the rejection criteria. The blood is our precious sample, but it can sometimes get rejected if it is received in an unlabeled condition, or if the bottle or the tube is cracked or broken. At the same time, blood culture can be accepted although not rejected, but even if the media is expired or the volume of the bottle is insufficient or received 12 hours after collection, provided that it should be documented and the deficiency in reports should be communicated to the physician. At the same time, it must be responsibility of a laboratory physician to develop educational plan to ensure that the cultures are collected appropriately. Now regarding the incubation, the blood culture bottle should be incubated at 35 degrees centigrade for usually 5 days. However, a longer period of incubation may be recommended, like in certain cases of slow growing organism like brucella. Then culture should be incubated maintaining the condition for that allows a better recovery of the microorganism. So there should be maintained in a incubation where it should be rotated and agitated routinely. If not manually, then at least automated blood culture system should be followed. Examine culture daily for the microbial growth. So what are the visible signs of microbial growth in cases of a conventional blood culture system? Then you should observe for hemolysis, if any, turbidity, which is again a sign of growth of a microorganism, gas production, again pellicle formation, puffball formation, or sometime clotting of the blood in case of blood culture system. However, automated blood culture system is free from these kind of examination as it continuously monitors the blood through its automated technique. Now regarding the subculture, for manual broth system, perform blind subculture to solid agar from visibly negative bottle after at least 24 hours. First blind subculture, then 48 hours, second blind subculture, and 72 hours, the third blind culture of the incubation. If, however, a laboratory is adopting a biphasic system, the system with agar and paddle. Remove the plastic cap from the bottle and securely attach the paddle. The bottle can be inverted to inoculate the agar, and then it can be incubated at 37 degrees centigrade. Invert twice daily for the first 2 days and then daily for the remaining days, and observe the broth and the paddle both for the growth prior to each inversion. Now let's see the blood culture limitations. Low level of organisms may not be detected in incubation interval of culture. So this is one limitation. So media which is usually BHI or a tryptase soya broth may not support the growth of some microorganisms. So multiple formulation must be required to increase the yield. Other disease can present similarly to bacteremia. So fever of unknown origin must be looked for non-infectious causes. Then bacterial metabolism may not produce sufficient CO2 for detection, especially in cases of automated blood culture system where CO2 production is the means of detection for the growth of microorganism. So there are a few fastidious microorganisms, of course, that infect blood, but that cannot be grown in routine culture bottle. So with this I finish the talk on blood culture. Hope you like it.